Welcome back. You're tuned into Lunch Money. Today, of course, is World Heart Day. Remember, heart diseases is the biggest cause of mortality worldwide, and India is not immune to it. In fact, linked to heart disease is also diabetes, and India is fast becoming the diabetes capital of the world. On this World Heart Day, our special coverage on how to keep your heart healthy, stay away from wrong lifestyle choices, and what can you do even at an early age to lead a healthier and safer lifestyle. Joining us to discuss this, we have Dr. Mona Bhatia, the head of radio diagnosis and imaging at Fortis Escorts Health Institute. She joins us via Skype from New Delhi. Dr. Bhatia, welcome into the show. Thank you for speaking to us. Just quantify for us the threat of heart disease in India. How many people are affected by it, and what's the kind of mortality rate right now?
See, the point is that, like you said, heart disease today is the biggest killer worldwide. It's the biggest killer in India for both men and women. Unfortunately, we forget that there are women also involved in it. So definitely, it is the biggest killer. There is an estimated over 45 million cases of coronary heart disease today in India. And 7 to 13% of the urban population is affected, and 2 to 7% of the rural population is also affected. Now, what's
small technical issue with Dr. Bhatia's line over there. We'll just try and reconnect with her. But in essence, what she was saying was 45 million people. That's the kind of number that is affected by heart disease in India. And it's while it is, of course, prevalent in urban areas, especially the metros, rural areas are not immune for it. I believe we have Dr. Bhatia back with us. Dr. Bhatia, just continue the point you were making.
Right. So the point is that what we have to understand is that the risk of coronary artery disease in Indians is 3 to 4 times as in white Americans. It's 6 times as in the Chinese, and we are 20 times as in the Japanese. So the risk is really high. And we do have a genetic predisposition, unfortunately. And this is true even for the Indians who emigrate outside India and go and live abroad. The pattern of disease that we see is very severe and diffuse. And unfortunately, it occurs almost 10 years earlier than in other populations. And the bigger challenge that we face in India is that it's the younger population that's affected. So Indians, even under 30 years, may have 3-vessel disease with a very poor prognosis. And the incidence in the youth is 12 to 16% in Indians versus only 5% in the Westerners. And if you look at the acute myocardial infarctions or the acute heart attacks that come, almost up to 40% of these patients may be under 45. So we're really groping with a disease which is at a much earlier age seen in our population. And then because it is seen at an earlier age, it has 2 times higher mortality. It has 3 times higher reinfarction rate. And our prognosis is much worse in Indians than in the whites. If you actually looked at it, the coronary heart disease mortality under 30 years of age is 10 times as in Chinese. So we have to take cognizance that we're really up against a disease which is now an epidemic in India. We are, in fact, the capital of coronary heart disease in India, of the world, and we're going to the point where we will probably have the maximum number of patients of coronary heart disease. So we need to start aggressively looking at prevention.
Right, and Dr. Bhatia, the other silent killer, of course, is diabetes, and both these are interlinked together, the cardiovascular continuum, as it were. What is the implication of diabetes in relation to heart problems that you can have, and also how can you possibly diagnose this at an earlier stage and the steps that you can take to prevent this from happening?
See, the point is that diabetes is one of the largest risk factors of coronary heart disease. When we talk about coronary heart disease, we're looking at various risk factors like high blood pressure, we're looking at obesity, diabetes, we're looking at high cholesterol, and all these matters need to be addressed, and we need to start looking at them at a much earlier age. Particularly if you have a family history, you're at a high risk, and if you think that, if you get to know at an earlier age, then you can take all the aggressive preventive measures in order to prevent going to the level of an acute coronary syndrome or to the level of a true heart attack. And I think one of the other big factors that are working against us in this generation is stress, because we find the youngsters between stress at work, stress at home, absolute no work-life balance, and even stress on the street while they're in traffic. So, and stress is the most non-quantifiable risk factor. stress by itself is not only causing elevated stress hormones and changing the way our blood clots, but more than that, it also worsens all the other risk factors for both coronary artery disease and diabetes. So it actually leads to an increase in the blood pressure. It leads to binging, be it fatty foods, fast foods, alcohol, smoking. It leads to an increase in the diabetes level, the cholesterol levels then indirectly increase, and it leads to obesity, sleeplessness, and all these factors actually become confounders to coronary artery disease. So definitely we need to be looking at stress management as one of the largest factors amongst our youth in order to get to a point where we can prevent. As far as how can we treat it or how can we check it, the reason for a coronary heart disease or for a heart attack to happen is because calcium and fat go and get stuck in the walls of the coronary arteries. They ultimately clog the coronary arteries and the lumen gets narrow and narrow over time, and ultimately it becomes so narrow that it doesn't supply enough blood and enough oxygen to the heart muscle for the heart muscle to function properly.
Right.
And when that situation comes, the heart muscle may die, and that is when a heart attack happens. So what we really want to look at is to be able to look at these plaques.
Right.
We want to be able to look at when this is early set in.
Right. Very quickly, Dr. Bhatia, just completely out of time on the show. India is a developing country. There are a lot of aspirational growth trends out there. How do you get the population to then put health before everything else? Because the immediate benefits of some of the steps that you are suggesting are not seen. Of course, these are long-term measures that one needs to be strict about. But how do you convince the population of India to move away from some of those aspirational desires that can lead to an unhealthy lifestyle as well?
I think no aspirational desires need to be reduced. All you have to make sure is that you make your lifestyle modifications so that your aspirations can be met. We need to be able to handle our own, control stress by ourselves, because stress means different to different people. People react differently to stress. I think we all just need to know that in this situation where we're all dealing with technology and sedentary lives, we need to use this technology, and we need to use it to our benefit, be it through, various modalities or going to get early diagnostic checkups done. Because what we do in radiology is we can actually tell you your lifetime accumulation of plaques in the coronary arteries. And that really helps, because once a person has seen the picture of his coronary arteries with the wall having a stuck plaque, it definitely motivates him, and his adherence to all kinds of lifestyle modifications is way higher than just knowing that, yes, he's got BP, he's got diabetes, he's got blood sugar, all that. It's just not the same as actually seeing that one picture. And that one picture, I think, really motivates my patients for sure.
Point taken, Dr. Bhatia. Let's hope the viewers who've tuned in for this take that point home and make the kind of necessary lifestyle changes that are needed to battle the threat of heart disease. Thank you for joining us on this special coverage of World Heart Day, Dr. Bhatia. For that, completely out of time on this edition of Lunch Money. Thank you for watching.